curves that I've described multiple times. This window that we're in is going to be very important for us to stay ahead of this curve.
I'm not going to say that the lab testing issue is over, because it's not. It's entering the next phase. But the much higher priority now is, now that we have the testing available, how do we get people into the system to be tested in the appropriate, prioritized way?
And news tonight that we may be one small step closer to a COVID-19 vaccine. A government official telling the Associated Press the first dose in a clinical trial for a potential vaccine will be delivered on Monday. So let's talk about that and all of your other questions with Fox News medical contributor Dr. Marty Makary and former White House physician Dr. Ronny Jackson. Good to have you both with us.
Thank you, Shannon.
Dr. Makary, I'll start with you there. I mean, the vaccine seems so far off. We continue to hear bits of good news, whether it's from Israel, here, Australia, other countries. What can you tell us? And it's not a cure. It would not stop this for somebody who is ill now. I mean, give us a timeline and what it would mean.
Yeah, I would tell people to be careful of this notion that we're on the brink of a medical solution to this problem. Vaccines generally take about a year because it takes time for the immune system to be built. And let's be honest, distribution is an issue. So we're not going to get a vaccine guaranteed in the next 4 to 6 weeks, which is when we're leading up to our peak. It may help with reinfection rates. But also, let's not hang our hat on a medicine that's going to cure this, because we've been working on a medicine for the common cold, which is another type of coronavirus, for about 50 years with no luck. So I doubt we're going to come up with one in the next 6 weeks.
Okay, I want to play something from Dr. Deborah Birx, who is very well respected across the board. Here's what she said today. She's part of the task force about the fact that we are going to get exponentially more tests and then more test results in the coming couple of weeks.
You will notice as these tests roll out over this next week, we will have a spike in our curve. For those of you who watched China and China reporting, remember when they changed their definition and all of a sudden there was a blip in their curve? We are going to see that. We are going to see a spike as more and more people have access.
And Dr. Jackson, that is going to psychologically be tough for a lot of people. We know the numbers are coming, but it's only going to get worse before it gets better, by nearly every estimate.
Yeah, that's right, Shannon. I mean, we have to expect this spike, just like she was saying. You know, the folks that are out there, the physicians that are going to be testing patients, they're going to start by testing patients that have clinical indications to be tested. Patients that look like they have coronavirus, those are going to be the ones that are going to be most readily tested. And a lot of those are going to have coronavirus. And so the numbers are going to go up. We just have to understand, you know, that there are going to be a lot of other folks that think they have coronavirus that don't have coronavirus. I mean, a lot of people that have coronavirus that don't even get symptomatic and don't get tested. So we don't know what that denominator is on the number, but it's going to look like for a while that the numbers are just going up rapidly. But I'd ask everybody to just keep in mind that those folks are already out there. We just haven't identified them yet, and it's not really going to change things significantly for us. We're just going to know that they're out there. I mean, it will change things from a public health standpoint. Obviously, they'll be better able to plan and prepare in certain areas of the country. But the numbers will go up, and it is going to scare people initially. But we just have to kind of remain calm.
Mm-hmm. Well, Dr. Makary, he makes an interesting point there. We know that there are a lot of asymptomatic, probably people out there. Can they, because they may never get tested, they don't feel bad, can they still be spreading the virus? And how in the world do we get our arms around that? You
know, that's the most concerning thing, Shannon. People are going to go out there and watch a soccer game and think, nobody out here is sick. I don't see what the big deal is. Why is everybody getting all worked up? And the reality is that it's hard for this virus to really hurt someone who's young and healthy. But they can be silent carriers, and that's what we really worry about, because when we visit older folks, when we've got a colleague at work with an immune problem or on chemo or had an organ transplant, they are extremely vulnerable to this, and that's where we're seeing the mass casualties right now overseas. Now, forget about China's data, forget about Iran's data. We know they're not transparent, but look at the data coming out of northern Italy. It is a preview of a movie that is about to play in the United States, and it does not look good. Those hospitals are overrun, and those numbers are looking really bad. 386 deaths just today in one day. Adjusted for the U.S. population and age, that's about 2,000 people in the U.S. that would die just today using the same figures. And they've got a total lockdown. we're not even, some people haven't even recognized there's an issue. 40% of Americans say in a survey they don't even think it's going to be a problem.
Okay, well, let's put up the map so we can show people what the numbers are, where the cases are. And this is constantly being reevaluated. I think this is from Johns Hopkins.
Yep.
There are a couple of really good resources tracking these things out there. So you can see 167,000 plus cases out there, almost up to 6,500 deaths. But that number up in the other corner there in green is the recovery, and a lot of people are still in process. But Dr. Jackson, do you think that part of the equation will in any way calm people? Because we see how many people do recover, people who do well. Those numbers greatly outweigh those who really struggle and end up losing their lives.
They do. I think most people that get this will, like I said before, will either have it and not even know they had it, or they'll get it, they'll get sick, but not very sick, minor cold and flu symptoms, and they'll recover. And I agree with most of what has been said, but I do think it's difficult to apply the Italian data to what's going on in the United States, or what might go on in the United States. And that's because, the Italians, 25% of the population is over the age of 65. I think their average age in the country is about 12 years older than we are. They have a large Chinese population that's there on a regular basis. A lot of them came in to Italy whenever it first broke out in China. They don't have the public health response that we have. They didn't lock their borders down initially like we did. So I don't think that we're going to see things get as bad in the United States as they're getting in Italy right now. But we'll have to wait and see. But I think we have a much better response. I think we've had a very aggressive response since day one. The president was aggressive in restricting travel from China, and then he's been also very aggressive. Once Europe was identified as a big source, he immediately acted on that, and we've shut down a lot of the travel from Europe now. So I think we're taking the proper steps right now, and I think that we'll be in a better situation than Italy was, for sure, in my opinion.
All right. Well, we hope that is the case, but I think we all need to be mentally prepared for whatever we're facing, looking out for ourselves and looking out for those around us, especially those who are compromised, elderly, or in some other way a special category and need our help. This is time to rise to the occasion. Doctors, thank you both. Good to have you both with us.